and we can begin at any time now.
Hi guys, so my name's Dr. Michael Hart, and I'm going to be moderating a panel today. And what we're going to be talking about is psychedelics and rewiring mental health care. And I have a lot of wonderful people on the panel today. So I'll just do a quick introduction, but I'll let everyone else introduce themselves. So we have Dr. Rachel Yehuda, we have Dr. Alan Davis, and we have Ronan Levy. And instead of me telling you guys a little bit about each person, I'll just let all the panelists introduce themselves. So Rachel, could you just tell everyone a little bit about yourself before we get started?
Sure. I'm a professor of psychiatry and neuroscience at the Icahn School of Medicine at Mount Sinai, and I've recently become director of the Center for Psychedelic Psychotherapy and Trauma Research at Mount Sinai. I'm very excited about that. I've been doing research in the field of post-traumatic stress disorder for about 35 years. I'm very excited to start looking at psychedelics towards improving people's mental health.
Excellent. Well, 35 years experience. That's quite a bit. So I'm sure you'll have a lot of interesting things and helpful things to share today. So Dr. Alan Davis, can you just tell everyone a little bit about yourself as well?
Hi, my name is Alan Davis. I'm a clinical psychologist with a specialization in addiction and trauma treatment. I've been working for the past 10 years on research related to psychedelics, primarily psilocybin therapy. I'm currently a faculty member at Ohio State University, where I work in social work and psychiatry. I'm also faculty at Johns Hopkins University, where I work with their psychiatry department and their Center for Psychedelics and Consciousness Research.
Amazing. You don't usually get, the social work and then also the John Hopkins, link to that university in one. So really happy to be chatting with Dr. Davis today. And lastly, Ronan, can you just quickly introduce yourself?
Sure, I'm the only member of this panel without a doctor in my name, so I apologize for that. But I'm Ronan Levy. I'm one of the co-founders and the executive chairman of Field Trip. Field Trip Health Limited is a company that's focused on building out the end-to-end infrastructure and tools and drugs for delivering psychedelic therapies at scale. So we're opening up Field Trip Health locations for the delivery of ketamine-assisted therapies right now, with the view to working with all psychedelics that get legalized or approved in the future, as well as doing our own drug development with a novel synthetic psychedelic molecule that should be entering phase 1 trials later this year.
Amazing. Well, we won't hold the non-doctor title against you, Ronan, but we're really excited to have you on the panel today, and it's great to hear that you're doing so much great work with Field Trip Health. So guys, let's just get started. And one question I think that everyone could answer and probably just spend 2 to 3 minutes on it if you can. But so I'll just start with you, Rachel, if that's okay. So what are you currently working on, and why are you working on it, and how do you think it'll kind of help mental health care?
Well, as I said, we've launched the Center for Psychedelic Psychotherapy and Trauma Research. So we're working on building clinical trials and figuring out what kind of scientific studies will support our understanding of how psychedelics are going to revolutionize mental health care. The center is also going to undertake training and education of therapists, as well as medical students in psychiatry and psychology. I'm interested in doing this because the results of early trials using psychedelics in mental health, and specifically PTSD and depression, have been so dramatic and unlike anything that we've ever seen before in mental health. We're not used to seeing people get so much better with a medication in mental health. And the way that psychedelics are administered is also pretty revolutionary, because these are medications that you don't have to keep taking. And let's face it, we know what we currently have doesn't work that well. So again, we're all here because we're interested in rewiring mental health care. And in order to do that, you have to do something very different, which psychedelics really are.
Excellent. Yeah, I think that's an excellent intro, and I think that most people listening to this are listening because they're looking for a different alternative than what's being offered traditionally, and obviously with all the research and everything that you're doing, hopefully that'll be offered more readily available to people in the future. Dr. Davis, can you just quickly tell us what you're working on right now and why you're working on it?
Sure. My current work at Hopkins is looking at psilocybin therapy for a variety of different indications. We're not only wrapping up our depression trial, which we published the initial findings last year in JAMA Psychiatry, but we're also following those patients up to 12 months after their treatment to look at some of the long-term outcomes. And we have new studies launching actually in a couple of weeks, looking at people with co-occurring alcohol problems and depression, which is something that is a frequent thing that co-occurs. And we have current studies going on with anorexia patients, Alzheimer's patients, and new studies coming with opiate use disorder, tobacco problems, PTSD, and other indications. My work here at OSU, I'm a new faculty here, so I'm currently building the infrastructure and the foundation to launch clinical trials with novel psychedelic tryptamines, specifically 5-MeO-DMT, as well as looking at psilocybin trials for trauma indications. So, my hope is that the work that's being done, that we've been able to get published, is going to lay the foundation for so many opportunities, not only for the research, but also hopefully for the betterment of the treatment options that we have for people suffering with these debilitating conditions.
That's that's excellent work, and I really appreciate the what you said about alcohol and also tobacco, just because I've seen a lot of veterans in my practice and a lot of patients with PTSD, and unfortunately, a lot of those a lot of the veteran patients do succumb to alcohol and a lot of tobacco. So I think it's important that we're not just addressing when we're addressing mental health, a lot of people just think it's PTSD and depression, but a big part of that is also addiction. And so really happy to hear about your work there, and definitely going to chat a little bit more about the addiction part later on. So Ronan, do you mind just giving us 2 or 3 minutes on how Field Trip is doing, and what you guys are working on, and how you guys are going to change mental health care?
Yeah, absolutely. So, as I mentioned previously, we're currently building out the clinical infrastructure actually to deliver psychedelic therapies at scale, so we can actually help reach the most amount of people possible. Because one of the challenges with psychedelic therapies is that because set and setting seems to be so instrumental to the therapeutic outcomes, the clinical infrastructure really doesn't exist to deliver this kind of care, I think, in the right frames and in the right location. So with Field Trip Health, that's really what we're focused on, building out bright, inviting, comfortable locations that put people in the right mindsets and in a place for healing and therapy to be performed with the psychedelic therapy. On the other side of the equation, with Field Trip Discovery, our drug development division, when we kind of looked out and saw what was happening with psilocybin in particular, I think everyone is incredibly impressed with the safety and efficacy we've seen around psilocybin to date. But one of the things we realized is that with most of the classic psychedelics, because the timeframes are so long, it becomes clinically difficult to administer to a lot of people. It makes it very expensive. So we set out to see if we could find something that really offers, we believe, a lot of the attributes of psilocybin, but in a much shorter time frame, so we can make it clinically more accessible. And that's what we're doing with FT104, which is derived from a known psychedelic that has a much shorter trip time, typically 2 to 3 hours, as opposed to the 4 to 6 you see with psilocybin, but hits the same brain receptors in substantially the same way. So it's a very similar experience, both in terms of the physical experience or the emotional experience, as well as what's happening in the brain. But because it's shorter, we think it's going to be clinically much more efficient. And so, the reason I'm so excited about psychedelics is because I really believe it's the platform to revisit how we think about mental health and bring a much more integrative approach to mental health, where we see it as a part of overall healthcare and not as reductionist as most, I think, modern Western medicine tends to be when it comes to healthcare and mental health care in particular.
Yeah, I think that's a very interesting point that you're making, and you guys are obviously doing great work. And the integration part, as everyone here agrees, that is definitely the most important part of the work. So it's great that you guys are providing that for your patients, because we know there's no such thing as SSRI psychotherapy, right? People don't do that, but people certainly are very interested in psilocybin psychotherapy. So thanks so much again for the introduction there, Ronan. So let's just start off by talking about what is psilocybin therapy, and why should it be used in conjunction with psychotherapy. And because I think that's a really important point, and one that we want to get across to our listeners, that we're focused more on we're focused solely right now on psilocybin assisted psychotherapy, not just psilocybin on its own. So I'm not sure if Rachel or Alan would like to jump in there and let us know why you think psilocybin is so much more effective when it's taken in conjunction with psychotherapy, and just a little bit about how that's integrated into someone's life.
Well, I can start and give you a more general idea about psychedelic assisted psychotherapy. The idea isn't to rely on the effects of the psychedelic, which, as many people know, are very profound. The idea is to use the psychedelic to create an opportunity to learn something about yourself, to see something that you would not otherwise see, so that you can begin to work with yourself in a different way, to have an insight that you can bring back towards understanding why you do the things you do, or why you feel the way that you feel. So ostensibly psychotherapy could do it, but it would take a very long time, and it's not done in a continuous way. But there's something about being in an altered state of consciousness that really puts you in a certain kind of frame to be able to have those really important insights. And that's why the integration is so important, because you have to talk about it afterwards. So depending on the psychedelic that you choose, you might have tremendous ego dissolution, but you might also feel a sense of compassion for yourself. You might lose some of the fears that normally inhibit you from delving deeply in yourself. So psychedelics really can promote this generalized environment, which is an opportunity. The opportunity, though, is brought to its fullest when you talk about what your trip really meant and what was highlighted.
Okay, well, I think you said that beautifully, Rachel, and that's absolutely, I think, what psilocybin and psychedelics can do is they can open things up. But once they're opened up, during the session, that's fantastic. That's great. That's a goal during the session. But the goal is really to integrate that back into your life. And we're not saying that that's something that's easy to do, but by any means it does take a lot of work. So again, a lot of the work has to be done by the patient, and not just relying on the medicine. The medicine's helping facilitate that, but again, most of the work is being done by the patient who's taking the psychedelic. I don't know, Alan, if you wanted to comment on that, on how you feel, the psilocybin is and the psychotherapy is integrated, and how people may see real changes in their life by integrating the psilocybin assisted psychotherapy into their life.
Yes, well, I certainly agree with everything Dr. Yehuda just said. The experience offers an opportunity, and I think that's what's really important for everyone to understand, is that an opportunity is just that. It doesn't mean that this is a magic bullet or that it's going to, solve someone's problems, but it does provide that option. It provides a possibility. We've had some people come through the clinical trials that, they were, as I'm sitting in there with them in the experience, they have everything from horrible, challenging, anxiety-ridden experiences all the way to the other end of the spectrum of beautiful, amazing, white light of love experiences and everything in between. what's fascinating is that so far we haven't been able to tell which type of experience is going to lead to the best kind of effect. In fact, we've had some people who have that anxiety-ridden, challenging entire day session who actually their depression ameliorates completely and up to a year later. And we've had some people who have the white love of bliss and their depression comes back. So I do think that integration, regardless of whether the acute effects were positive or negative, or how you interpret them as whether that's positive or negative, that it is about what you do with that and what sense you make of it and what it can be there to teach you. We frequently tell the people coming into the studies that, this experience can be a teacher, and there are potentially important things to learn through this experience. That doesn't always happen in a very clear, linear fashion, as one might imagine with psychedelics. Sometimes it's very confusing. And so we do spend quite a bit of time in the therapy afterwards, trying to understand what was the meaning, if there was any, what was the significance, if there was any, and most importantly, what do you do with that? How do you take that forward? And for some people, it's very clear. They'll get an insight that their relationship is not serving them and it's holding them back, or they'll get an insight that there's something deeply painful about a past experience that they want to now work on and go into therapy and really focus on that in a way that they had never known was important to them before. And then that empowers them to take that opportunity to move forward in those directions. I will say that it seems to be, in my anecdotal experience in these studies, that when people do listen to those insights and they do proceed to work on them, that they seem to fare better than those that have a hard time doing it. As you might imagine, some people have these breakthrough experiences, and that information is not always easy to hear. Those insights are not always something that is welcome. And sometimes it means that there's people that don't want to go in that direction. And I think it's those people that tend to have a relapse of their symptoms. Again, that's not necessarily something we've been able to see scientifically yet, but anecdotally as a clinician, that's some of the things that I've seen. So I certainly think that it's important that when these treatments are investigated, that we continue to have the rigorous therapy that comes along with it to both prepare people for these experiences and also to help them work with these issues that come after the session day.
Yeah, I gotta say, Dr. Davis, I really appreciate what you said at the beginning, though, saying how some people have these white light experiences and they're beautiful, and some people have poor anxiety-ridden experiences, but in the end, the outcome for their depression is still the same, because a lot of people are very, very afraid of trying psilocybin for that reason. They're afraid that things are going to surface that they don't want to deal with. So I think that was a really, really good point. It actually reminded me, I'm not sure who said this, but they said that psychedelics give you what you need and not what you want. And I think that it's important for people to know that. So thank you so much for bringing up that point. I think that's really important for our listeners to hear. So Ronan, for yourself and that field trip, is there anything that you guys are doing specifically with the psilocybin therapy and the integration part that you can share that you think is helpful for your patients that will benefit them more, say, in the long term than just in the session itself?
To some degree. I mean, we're going to be working with patients using psilocybin at our Amsterdam location, which should be opening in the next couple of months. So we'll have an opportunity to work with something more than just ketamine. And we have supported some people with Section 56 exemption applications, which is a path to access in Canada on a one-off basis. The one thing, I think Alan and Rachel really expressed it very eloquently, and I don't have a whole lot to add in terms of being able to speak to their scientific knowledge because they are amongst the world experts. But what I've seen anecdotally in our experiences in our clinics and beyond is, I think one of the things that also is important in terms of the healing is how psychedelics enable people to reconnect with a sense of the profound. So much of the conversations we have around psychedelics is about healing and trauma and experiences that we revisit and can reprocess and start to work through. But, one of the things that really touched me recently was we had a patient who talked about, it was her first experience with psychedelics, and she found that things were profound. The mundane was profound. And what it kind of touched on me is how much of that has been lost in our society. So science has done such a good job of creating knowledge, but it's really taken away meaning. And I think if we look at some of the broad-based causes of sort of the social malaise we have, I think probably a big part of that is the loss of meaning, the loss of, wonder, the mystery, and all that kind of stuff. And truthfully, we see it in the evidence that the more mystical experience a person has, it tends to lead to more therapeutic outcomes. And so I think that's an important part of the conversation, that it's not being excluded. It's just not the focus of the conversation, but I think it's really meaningful and something we should be paying attention to.
Yeah, I like the point you made, because a lot of people sometimes, before they do this therapy, they kind of feel like, I know I need this, but I still feel like I'm doing okay, kind of thing. And then after, their session, the mundane things, as you kind of said, kind of come up. So they actually enjoy things that they didn't realize that, they kind of missed out on in the future, or sorry, prior to their session. So, I think that's a really important point to make, and I'm glad that you brought that up. Is that, sometimes people, they hardly even know that they're depressed, and then once they use this medicine, things come up where they actually, it's bringing them joy that they didn't realize that could bring them joy before. And I've had, people too tell me that, like, even just the music that they listen to, a lot of people, when they do these sessions, they generally don't listen to music with like lyrics and things like that. It's generally just like, tones, meditation music and things like that. And then after the session is done, someone who wants to integrate that into their own life, they might still continue listening to these sort of like tones, meditation music, that type of stuff. So, really important point that you made there, Ronan. So I appreciate you saying that. So I think my next question is mostly for Alan, and I know he's touched on it a little bit, but I would like him just to expand on it a little bit more. So, Alan, how is psilocybin being used in research settings today? And we're going to talk about treatment-resistant depression, anxiety, OCD, but also to what you chatted about before with regards to addiction for alcohol and cannabis and anything else related. So if you could just expand on that a little for us, that'd be wonderful.
Certainly. So currently, as far as I know, and I don't know everything going on everywhere, but especially the last year, there's been an explosion, I think, in terms of different researchers getting interested and really wanting to build this line of inquiry. But of the studies that I know of, psilocybin is currently being used for a range of the things, including addiction, for a variety of different substances, as well as depression, both treatment-resistant depression and general major depressive disorder. It is also being investigated for eating disorders, for neurocognitive disorders, or more important, the mental health problems that can come along secondary to neurocognitive disorders. And new investigators are coming in to now look at things like fibromyalgia, chronic pain, and a variety of other things, including PTSD. So I think that what this speaks to is the potential for psilocybin and psilocybin therapy in the context of that therapy to provide an opportunity across different types of problems, what I would call a transdiagnostic opportunity to hopefully get to some of the root causes of the dysfunctions that potentially are going on at the root cause of all of these different issues. Now, what exactly that is, I don't think we know yet from a scientific perspective. Ronan mentioned that, looking at the mystical experience has been one of the things that seems to be a hallmark across different studies as something that's related to the potential benefit that some people get. And that's certainly something that we see. However, we've also started investigating psychological insight, ego dissolution, emotionally cathartic experiences, psychological flexibility experiences. And what we're seeing is that it's likely much more dynamic than just the mystical experiences. That probably doesn't surprise anyone who's ever had a psychedelic experience themselves, right? There's a lot of stuff going on, from the emotional to the transformative to the psychological to the physical. And it's probably a combination of these things that are contributing to the outcome. What it looks like is, a therapy session that helps people prepare for these experiences. We typically spend 8 to 10 hours with them ahead of time to build safety and rapport with the guides, the therapists that are working with them. The session days, obviously, our entire day-long sessions with psilocybin, which is both an advantage and a disadvantage. It's kind of a luxurious experience as a clinical provider to be able to spend an entire day with someone, and the amount of rapport and connection you can build with someone across this experience is really powerful and likely helps the change process occur. That's not something that we typically get in standard mental health care, where you might only get 45 minutes with someone in a session, or at best an hour. But it also has a disadvantage of taking a lot of resources and time. And so, but in the context of the current studies, I think it's a real benefit to have all of that time with someone. The integration therapy sessions are also very critical. And again, I think, regardless of the specific problem someone has, I think these transformative experiences provide that opportunity for change.
Excellent. Yeah. And just with regards to, the full day session, like, I think that's wonderful, just because, a lot of people, when they're seeing their GP, they're only with them for 15 minutes, generally speaking. When they see, a psychotherapist or a clinical psychologist, it's more like an hour, which is much better. But, you can't compare that to like 8 to 10 hours. Once you spend 8 to 10 hours with someone, you can certainly, open up to them a little bit more. You get to know that person. And I think that, you may be able to relate to that person. And that's what, people are sort of looking for, I think, these days, is, someone that they can also relate to and rely on. And, when you're doing a session for 8 to 10 hours, that's quite a long session, and then all into the pre-work before. So that's something that, again, is not seen in healthcare these days, and that's why one of the reasons why we feel like psilocybin assisted psychotherapy and psychedelics may be able to change things in the future. So my next question, again, probably directed again towards you a little bit, Alan. But for people who are really into the science behind how psilocybin works, some people just want to know exactly the mechanism of action and that type of thing. I was wondering if you could just expand a little bit on receptors, how psilocybin affects certain receptors, and when it hits certain receptors, what are people likely to feel emotionally and psychologically?
Well, I also want to know the answers to those questions, which is one of the reasons why I'm so fascinated about this topic and these studies. We know a little bit about this. We know that the classic psychedelics, of which psilocybin is a member of that class of drugs, we know that the classic psychedelics probably hit a whole cascade of different receptors. It's probably not just one. However, they seem to really strongly hit the serotonin system in the brain. And the 5-HT system, or the serotonin system, is part of the brain's ability to regulate things like emotional function, sleep, sexual drive, and other things. And so it's possible that because it hits this system, which is also responsible for things like, for example, someone who's depressed is going to have dysregulation in their serotonin system. Someone who has PTSD might also be experiencing dysregulation in that serotonin system. It's possible that by hitting this system, separate from the acute effects and the meaning that they might provide for someone and the opportunity from a psychological standpoint that they might provide, it's also possible that it's strengthening or refocusing or rewiring these different systems in a way that might produce the benefits that we're seeing. As an example, we have some data that we're hopefully going to publish later this year from our depression study, where we looked at people's brains in a scanner prior to treatment and also after treatment. And one of the parts of the brain that we know from a lot of research is implicated with depressive symptoms is the amygdala, which is the part of the brain that is very emotionally reactive. And for people who are depressed, if they're walking down the street and they see someone on one side of the street with a frown and someone on the other side of the street with a smile, their amygdala is going to light up to the frown, and they're going to attend to that information, that negative information, with an emotional context more than a positive emotional context. So what we found in our study was that this part of the brain after psilocybin therapy was less reactive to that negative emotional information. And that in and of itself was correlated with the antidepressant effects of the drug. So what we think we're seeing is just one signal here, is that there are biological changes that can occur for some people after having this treatment that seems to be not only related to why we think what's going on in the brain when people are depressed, but also potentially why this treatment's effective.
That's a really important point. I really like how you brought up the amygdala and that analogy of people, walking when you're walking down the street and you see, someone happy and someone unhappy, and that someone who has, PTSD, their amygdala is just going to light up and kind of, dig in on the negative type of thing. So, literally, when we're using these medicines, psilocybin, and we can in fact, rewire our brains. And there's another point you kind of made in there, and just kind of reminded me that a lot of the times the people who are most against these medicines are the people who would benefit the most in some ways. And it's because when you're so against something, a lot of the times you're very, very closed-minded and you're not open. And when you use these medicines, generally speaking, it opens you up a little bit more. So it's just kind of ironic that unfortunately, a lot of the people who are most against this medicine, are not going to benefit from it, and they would benefit from it tremendously because of how the brain is wired, in that negative state. So thank you so much for bringing that up and explaining everything about the amygdala. I think that's really important. And, people should know too that once your amygdala is firing, it's very, very hard to use your prefrontal cortex, which is essentially, your smart brain. So when they say that they're in such a state that they didn't know what they were doing or they can't really think, it's because literally they can't. They just have their amygdala firing, and they're not using their prefrontal cortex. So, thanks so much for sharing your opinion on that. I'm not sure, Rachel, if you wanted to comment on that as well.
I can add to it a little bit. I think that there's more going on than just serotonin and the amygdala here, because the medications that we have now affect the same serotonin receptors. And we don't get this kind of effect. The medications that we have now also cause the same changes in the amygdala. And guess what? They don't have these same effects. So, something called true, and unrelated. So I'm positive that those things are observed when people do imaging studies of psilocybin. But is that really what's causing the change? And I think that what's so exciting about psychedelics is that it's can become a fantastic tool for neuroscience to explore things that haven't yet been explored, particularly if we're going to say that mystical experiences, spiritual experiences, connectedness, and all of those things are involved in healing and not just dampening down a fear response. And the thing that's excited me most are the studies that are coming from actually Hopkins and other basic science laboratories showing critical period plasticity and the potential for neurogenesis to occur following psychedelics. So we're going to have to look for novel mechanisms here. The other thing that's really important is that we shouldn't restrict our focus to understanding just what is happening while your brain is on drugs, the pharmacologic effects of the medicine, because what's really fascinating here is the fact that 2 weeks, 2 months, 2 years after a psychedelic experience, the person continues to change and transform. And in a way, this so reminds me of the question of PTSD in a funny way, because in PTSD, you have an initial trauma that activates the fight or flight response. And we all know about what the fight or flight response is. But that fight or flight response isn't really responsible for the fact that months and years later, someone continues to have chronic symptoms. And the same thing with psychedelics. You can have an immediate response that has to do with the pharmacologic properties of the drugs that are very widespread. But the real important question is, what are the molecular, epigenetic, and other neuronal processes that are really helping explain why you continue to grow, why you continue to transform, why you no longer feel alienated from the world, but you feel a part of it? For many people, they find a real reason to live, whereas before they felt that there was very little purpose in it. So all of these spiritual and psychological processes are greater than simply the immediate neurochemistry or even neuroanatomy of what is happening, even though that's certainly an important place to start.
Well, you really made a lot of good points there, Rachel. I'm so glad you brought up the neurogenesis point. And I was actually, fairly surprised, and maybe you or Alan and Ronan know a little bit more about this than I do. But I saw, fairly recently that the lengthening of telomeres. So, for people knowing the most objective measurement we have now for aging is the length of your telomeres. So the longer your telomeres and the longer you live, so to speak. It's not that easy, but that's sort of the general mechanism behind it. But we're also finding that a lot of people have shortened telomeres who have poor mental health issues. And in the neurogenesis article that I read recently on psilocybin, it said that it would actually decrease the people using psilocybin are actually basically using an anti-aging medicine in some ways, and the anti-aging medicine is also beneficial on their mental health, which is excellent. Second point I wanted to make off that too, I thought was a great point you made, how it can be a tool for figuring out psychology and pharmacology and how our brain works, and how different receptors work. And it's a shame that it wasn't studied decades ago like it is now. So that's another really important point that I think you made. And then the last one you made there too was just the spiritual aspect of it. And that again it's something difficult to chat about in an objective way, but it's something that everyone who uses these medicines experiences. And again, we are talking about solving healthcare today, or rewiring the brain. And people who use SSRIs, SNRIs, they're not getting spiritual experiences, but people who use psilocybin do get this spiritual experience. So I thought there was a few really good points you made there. So I really, really appreciate that.
One thing to add to the conversation, I just saw a study yesterday, I think, about ayahuasca, about how the anti-inflammatory markers associated with psychedelics, because this was not news to me, but psychedelic compounds, many of them are actually potentially potent anti-inflammatories, may also have an impact, which I think in some ways connects to your conversation about telomeres and the lengthening of telomeres. There's a lot going on, and it's incredibly exciting. Of all of this, from the spiritual to the psychological to the physically biological, not necessarily pertaining to the brain or the serotonin systems either.
Yeah, that's a really important point, Ronan, because I've seen that there's been some studies done, and again, I'm not sure how many human trials we have on this, and maybe you guys know a little bit more about this than I do, but I have seen inflammatory markers have been linked to depression and poor mental health. So if we're reducing inflammation in the whole body, that's great, but if we're reducing inflammation potentially in the brain, I mean, we might even get even more dramatic effects. So really important point that you that you brought up there. So thanks so much for sharing that, Ronan. Is anyone else wanted to share anything on that before I moved on? Okay, so we're just going to ask Alan a little bit about, again, the purpose of the integration and what it entails. And I know that, you went into that a little bit with regards to, you said that people are doing about, I think you said about 8 to 10 hours of some integration work before they actually have their sessions. So like, are they journaling before? Are they, doing some psychotherapy on their own before? Are they learning about the medicine? Like, what is it exactly? Do these 8 to 10 hours entail, and what are patients specifically doing to help them prepare them for their journey or for their psychotherapy session?
So all of those hours are actually done with 2 trained guides, one primary therapist guide, either a medical doctor, psychologist, or a social worker. And then frequently the second person in the room is also a trained therapist, although we've had other co-guides who are in training in that role. And we spend that 8 to 10 hours developing rapport, getting to know each other, wanting to make sure that we're able to establish trust and a sense of safety for the individual who's going to be coming in and taking an experimental medication. We spend time learning about their life, wanting to know about not only the things that are problematic for them, but also their successes. We want to know about the things that they've had experiences doing well in their life, and also their values and who's important to them. So we spend a lot of time focused on this life narrative history in order to really build that connection. And then we spend quite a bit of time talking about psilocybin, its effects, and the potential things that could come up during a psilocybin session. We obviously can't cover every possible scenario, but we do a lot from our historical work of administering, I think now over 600 or 700 sessions in the Hopkins team. We try to bring in everything that we've learned about the variety of experiences to really help lay a foundation for folks, so they have at least something to think about when they're trying to determine how are they going to deal with the effects when they come up. For most of our people in the studies, they've never had a psychedelic. Some people have, but it's been decades, and maybe it wasn't a very big experience or powerful experience. So we talk about what a big experience looks like, and what are some of the things that might happen, both potentially scary things as well as beautiful and amazing things. We give everyone the same mantra. We encourage people to practice this before they go into their session and during their session, which is to trust, let go, and be open. We want people to trust what's happening, to let go into it, to dive into it, to go into it as fully as they can, and to be open to whatever emerges, whether it's challenging or whether it's beautiful. If they're scared, we want them to dive into that as much as we want them to dive into something that's filled with love. And the reasoning behind that is really to help encourage people to start to develop a sense of mindful attention to whatever's going on in their body, whatever's going on in their mind or their emotions, which of course we know from other types of treatments can be helpful for people, right? That we also know from the mindfulness literature, right? That people who meditate, who practice this on a daily basis of how to be present with themselves and sit with different emotions, that these have positive effects on mental health. So we do a lot of that to help them prepare for what could be a very profound day. We spend the last bit of our therapy time before their session actually running through all the mechanics of the day. We actually, in our lab, we have, it looks like a living room setting where there's a couch and side tables and art on the wall, but we encourage people to practice what it's like to lie down on the couch, to have eye shades on, to have headphones on. We turn on the music, we dim the lights, and we kind of do a dry run, if you will, of what that day is going to look like for them. And we do that because we want as much of the questions that they might have about what is this going to be answered as best we can with the things that we can answer ahead of time. Then after their session, when we get to the integration therapy, we're using those sessions to talk about what happened that day. We want to hear from them, obviously, all the things that they can remember and the things that they're trying to make sense out of. And so we typically have them write a narrative report on their own ahead of time before we meet, in order to just start to put into words something that can often be ineffable and difficult to describe. We have some people who do that in pictures. We have some people who do that in very eloquently written narratives. Some people do bullet points, but the point of it is just to start to try to pull out of the experience the meaningful components to them. And then we use that in the integration therapy to help build the process of what it looks like for them to move forward. What are the things that they're taking with them? How are they going to use this information if it is new information to them? What are they going to do with that? How are they going to take that forward into their life? For some people, it's very clear. They come in and they're like, I had this amazing experience. I learned X, Y, and Z about myself, and now I want to move forward and do this thing differently. And they do, and it's very incredible to see that. For other people, it's not so clear-cut or straightforward. Some people have very confusing experiences that take much longer than we can in a research study to try to figure out. So when that happens, we spend our time talking about, what do you do next, right? It's always about how to take this and move forward. And for some people, that's very clear. For some people, it's not. Either way, we hope that the process is the same. If it's confusing, we tell them to trust that and to let go and be open to the fact that they may never fully understand all the complexities. We've had some people who come in, in the days and weeks after their session, and they never make any sense of it. It's very confusing. And then a year and a half later, we'll get an email from someone and they'll be like, you'll never believe this, but I finally understand what that crazy thing was that I was feeling in my body. And it didn't make sense to me then, but now I've like worked with it and I've been, trying to pay attention to my emotions in a different way. And it makes so much sense to me now. We've run into this many times, like Dr. Yehuda said, where, this is something that's not necessarily going to be clear cut in the day that it's happening, but it may take months or years for this to fully be realized and understood. What's also interesting is the idea about whether we're talking about an altered state or altered trait. And I think that what this opportunity gives us is to take an altered state that may actually produce an altered trait in somebody. And if that trait is something like mindful attention or openness to experience or other things, I think that those are the things that probably have the long-lasting influence on how someone's going to approach their day-to-day life.
And if I could just add to that, it was a very comprehensive answer, but I think when we're talking about people that have had real mental health problems for a long time, like trauma, like really deep traumas underlie a lot of mental health problems like depression and PTSD and anxiety and addiction. The natural tendency for many people is to suppress those traumatic experiences and bring them down, down, down so that they don't have to deal with them. And a lot of the mental health symptoms are around trying to help compensate for some of these feelings that you're not letting yourself feel. What's really important is that once you start opening up yourself and your consciousness towards understanding something that you've not understood before, or seeing a traumatic experience in a new light, or being able to look at something like abuse or vulnerability that you haven't been able to look at before, you have to talk about it. Because if you don't talk about it and you don't try to make sense out of it, then the experience of the psychedelic might just flitter into the ether. So the purpose of the integration is to really help solidify the experience that you had on the psychedelic so that it isn't transient, but that it really becomes part of you, that you carry it with you and you move forward with it, which again, is uniquely accomplished when you have this kind of really compressed, out of body, altered state of consciousness, or a different transpersonal state.
I think, sorry, though, what Rachel touched on is like what makes me so excited about everything that's happening, because what you described there, the research and the focus is right now on people who have had intensely traumatic experiences, but trauma is a common experience to all humanity, right? So all of us in some ways, just as all of us can benefit from just doing conventional therapy, I think there's incredible potential for everybody to benefit from psychedelic therapy. We're just at a point right now where we're delineating between whether someone's got something that meets the DSM criteria or not. But, what makes me so excited about the future is how that becomes a platform for this entire conversation for, every approach to mental health and emotional awareness for literally every person on the planet. Because what you described is so common to our experiences as human beings.
Yeah, and I really just wanted to go back to Alan just for a second, just because he mentioned the intentions and trust, let go and be open. I really, appreciated him saying that. I was just wondering too, like, do you ever get some patients who come in with like very specific intentions, like meaning like, this one person abused me at work or from long ago, and can I just kind of, concentrate on this one person or on this one thing that's bothering me? And like, how do you direct someone who sort of has that attitude that just, wants to fix maybe one or two specific problems? And does that even come up very much?
So we certainly have some people who come in with very specific intentions. And one of the things that we try to discuss ahead of time is the difference between intention and expectation. And intention is fine. To want something and to intend to explore it in a psychedelic session is certainly fine. What we don't want people to do is to have an expectation that it's going to happen, and if it doesn't happen, that somehow something went wrong, or it didn't work, or they didn't get what they needed. And we try to ask people to the best they can, to, if they have an intention, to go into the experience, let it go, to welcome it if it comes up, to be ready for it, to be curious, but to also recognize that it might not come up in the way that you will recognize it. We don't always know whether someone's experience is going to be intensely visual, for example. Not everyone has visual experiences, and the people that do have visual experiences, we don't always know what kind of visual experiences they're going to have. Someone might experience a psilocybin session very emotionally or very physically. And so that in of itself may somehow be related to their intention. We don't know, but we don't want people to imagine that they're going to, have this intention realized in some specific way. So we try to encourage them to again, to trust and let go and be open about that as well. And to the extent that they can do that and go into it being curious about whatever comes up, does seem to be what we think is providing the best opportunity for them to get what they need from that session.
Excellent. And Rachel, I gotta say, really appreciate what you chatted about earlier, because about protecting yourself, and that's what a lot of us do. We don't want to talk about or think about the things that we obviously need to talk about, and we unfortunately suppress them. And that's when this ego dissolution thing comes up. When you're using psychedelic medicines, oftentimes your ego kind of dissolves, and you can, to a point where you can actually deal with these things, because when you're not on the medicine, sometimes it's just too hurtful for your ego. It just needs to do whatever it does in terms of protection, and then we never really get to the root problem. So I thought that was a really good point that you made there. And then Ronan too, also to your point too, I mean, that I think is sort of like an ethical dilemma, or something that's coming up maybe a little bit in medicine now, is treatment resistant depression. So like it's probably a struggle for all of us when we have someone who comes into our office or wants a psychedelic session, and they've never tried SSRIs or any of these things before, because right now people are basically supposed to try these things before they're being offered psilocybin assisted psychotherapy. But I think that we do need to look at potentially using psilocybin as a first line therapy, as the same as we're looking at SSRIs and other medications. And we're certainly not saying that lightly in any way, shape or form, but we just feel that maybe in the future people don't have to fail on clonazepam and fail on Celexa before they use psychedelics. Like maybe in the future people will just be able to use that right away and not have to go through that experience.
Yeah, I would just like to clarify, we actually, at least at the team at Hopkins, we don't have it as a requirement that people have had and failed other treatments before coming into our studies. A lot of them have, just because most people have tried other things and it hasn't worked. But we have several people in our trials who this is their first attempt at treatment. And because we're not looking at treatment resistance as a specific indication for these conditions, it's the case that we can frequently also include them as well.
Okay, I think that's excellent. Sorry, go ahead, Rachel.
I'm sorry, and it's also really important in your summary that you made, which was excellent, to underscore the fact that psychedelics might not be for everyone. And one of the important jobs that we have to do in research right now is figure out for whom these treatments might be contraindicated. And this is going to be something that is very important in terms of being able to safely roll out psychedelics to whomever will benefit from it. Again, sometimes psychedelics can be an early treatment or preventative treatment. I look forward to those times. I think that there's a lot of potential there. Sometimes it's a last resort, and sometimes it might not actually be what is indicated. So this is why the research that is going on now in medical schools is so important, because we really need to be able to understand this very, very carefully, and a lot of the basic science work that is being done together with the clinical trials, I think is going to be really, really helpful in being able to tell us more about who should and shouldn't be taking these psychedelics.
Yeah, and before we move on to the last part, it's a really good important point, Rachel. Again, I meant to bring it up earlier, actually, how you said how some of this stuff is now being integrated into some of the medical curriculum. Because a lot of the times, people always ask the question, why aren't doctors using these medicines? And for the most part, it's because it's not built into their curriculum. But hopefully, once it's built into the curriculum, more doctors, more physicians will feel, and healthcare practitioners will feel more comfortable with these medicines, and that will help change things. So I know we only have about 10 or so minutes left, and for the most part, we've kind of concentrated, more or less, maybe not completely, on sort of like the positive aspects of psilocybin and psychedelic therapy. But obviously, in medicine, all medicines have benefits and risks, and all medicines, can bring up challenges, not just for the patient, but also for the therapist and for the physician. So, Rachel, I'll just start with you. What challenges have you seen using psychedelic therapies, and what do we need to watch out for in the future to make sure that we don't make any of the mistakes that we perhaps made in the past?
Yeah, well, just the challenges that we have to, that are ahead of us, is to really make sure that people who take psychedelics are doing so in the most conducive therapeutic environments. We need to make sure that people of color have guides that are also guides of color, that people feel really safe where they are. So safety is number one, I think, in terms of psychedelics. So I think that that's an important challenge. We have the challenge of making the setting conducive to a psychedelic journey. And in most conventional medical settings, that's not the right setting. So how do we conform the right kind of setting in addition to the intention and the set? How do we develop places where we're going to be able to deliver effective, efficient, responsible healthcare, but in an environment that is completely conducive to wellness and healing? And how are we going to make it available to everyone that needs it? I think those are some of our most significant challenges.
And Ronan, you want to go next, if you don't mind? What challenges are you seeing at Field Trip now, Ronan, and how do you see maybe solving those in the future?
You know what? We're not facing a lot of challenges so far. The response and feedback has genuinely been fantastic. So I think it's just a matter of really staying the course, focusing on great patient outcomes, great patient experiences, supporting the work that Rachel and Alan are doing in terms of advancing the science, because I think a lot of the stigma that exists can't exist in the face of objective evidence. So the more objective evidence we have around these therapies, the better the understanding, the better the outcomes. It's got a very powerful momentum behind it, and it's got an urgent need. So things are generally going quite smoothly overall for us.
Well, that's excellent to hear, and thanks so much for sharing that, Ronan. And Alan, I'm asking you last this question. So, what challenges have you seen with psychedelics, and how do you feel that we can solve them in the future?
Well, I certainly want to echo everything Dr. Yehuda said about our needs to make sure that we're diversifying not only the populations who are receiving this in research settings, but also the people who are on the investigator teams and the people providing the therapies. These are critical issues that will be needed to actually scale this into the populations that need it the most. One thing that I will mention in addition to all of that is something that I feel very passionate about, which is actually starting to create opportunities for young academics who are in undergrad and graduate school now, who are going to be the next generation of this. They need to be supported. They need to start to get into trajectories that can lead them to the types of training and the types of places where they can get the mentorship to be ready to be the next leaders in academic spaces. And that's going to include trying to diversify the types of students that are included in those opportunities. So work that's being done at Source Research Foundation is one great place where that's happening, where we're starting to identify this need and to hopefully get people into these pathways so that we can create a robust interdisciplinary field of inquiry going forward.
Excellent. Well, guys, I think we actually might have time just for one more quick question, and I know this one is, something that we could, easily spend a full hour on, but just very, very quickly. And Alan, I'll just start with you. Like, what do you make of the move to decriminalize psilocybin, and do you think that's going to help or hinder research efforts?
Well, I think there's two things that I see happening. One is decriminalization, and one is a attempt to medicalize this at the legislature level. I think that decriminalizing substances, I think, is something that's important, in part because I believe in a public health model to substance use as opposed to a criminal justice model to substance use. That is separate from a medicalization that's occurring in Oregon and potentially some other places. That, I think, you're putting the cart a little bit before the horse, and I worry about the possibility of some people, before we have all of the rigorous multi-site phase 3 data, and we know for sure that it's going to be safe and effective for people in these larger studies, and the FDA has a chance to review that information, I worry that there is a potential for some risk. Now, that said, we also know from the scientific literature that even compared to other substances that are out there that people use recreationally, these are still relatively safe things. But again, I just hope that whatever unfolds with those movements, that it's done in a way that mimics and respects the science that's going on, and that it doesn't get in the way or hamper the opportunity that we have over the next couple of years to actually get FDA approval for these medicines.
Understood. And Rachel, do you have anything to say about the decriminalization of psilocybin?
I completely agree that decriminalizing medications is not consistent with a public health model. I think that there are medications that we can get over the counter that can not be good for us under some circumstances, and that we need to provide a lot of education to people. But we also have to protect them at the same time. And so the question always becomes, how do you provide the information and protect people? And it's something that we really have to think very carefully about. So I completely understand.
Okay.
Yeah, I think that I think Dr. Davis said it perfectly.
Yeah, I think Dr. Davis said it well as well. And Ronan, lastly, what are your thoughts on the decriminalization of psilocybin and whether it will help or hinder research efforts?
Yeah, I'm also supportive of decriminalization. Broad-based drug policy reform, I think, makes a lot of sense. I think Alan said it best when he talked about, taking a medical therapeutic approach to addiction and substance use as opposed to a criminal justice system. I'm more in support of the medicalization approach as being proposed in Oregon, simply because I think philosophically, I'm more, I respect people's autonomy and agency to make decisions for themselves as a default, as opposed to restriction as a default. And given, the anecdotal and historic evidence associated with psilocybin, at least in particular, there's a good foundation that there's a reasonable degree of safety. And so the structures put in place or proposed to be put in place in Oregon, in my view, creates a system that doesn't eliminate potential risks, but maximizes potential benefits while minimizing potential risks in a way that gives people autonomy and agency and gives them some control over their healthcare back. Whereas in the current modern Western convention, it's really controlled by doctors, and people are very often put into a passive role in their medical care. And I think that's unfortunate. So, but I think generally speaking, we're aligned in principles and viewpoints, which it needs to be safe and it needs to be done thoughtfully. No argument there. I would just lean towards access as a default as opposed to restriction.
Fantastic. And guys, unfortunately, we're just about out of time there now. So Ronan, can you just tell everyone, where they can find you online if they want to learn more about you and more about Field Trip and more about psychedelics?
Sure. Yeah. If you want to find us online, our website is fieldtriphealth.com for our Field Trip Health locations and clinics. If you're interested from an investment perspective, meetfieldtrip.com is our website. And on socials, it's at Field Trip Health. And I'm at Ronan D. Levy, D as in David, on socials as well.
And Alan, where can people find your work online, and how can they find a little bit more out about your research?
Yeah, if you'd like to follow me, you can find me at hopkinspsychedelic.org, at sourceresearchfoundation.org, or you can find me at Ohio State University College of Social Work website.
Perfect. And Rachel?
Yes, you can follow me on Twitter at Rachel Yehuda, and you can follow the center at Twitter at MS Psychedelics, and also on Instagram, Rachel Yehuda, PhD. And our website is ICANN, Center for Psychedelic Psychotherapy.
Well, thanks so much, everyone. I learned a lot today. I hope our listeners learned a lot today. Please leave any comments or questions. And if you want us to do this again, then give us all a shout on our social media, on our websites. Let us know, and we'll do our best to get back to you and all of your questions. All right, that was the end of it.
Thank you, guys.